Yeah, thanks for recording because I know a few people could not attend, so this would be nice to share.
Sounds great. Thank you, Kathy. Just want to make sure everyone can see our presentation and hear me well.
Yes, I can see it good. Yeah.
Okay, awesome. So thank you for joining us today for this presentation. Emily and I are really excited to be here to present to you about what we've learned from our summer internship and to talk about the importance of the registry. And before we begin, we just want to help yourself to familiarize with myself and Emily. And just showing here. So, Emily, would you like to start introducing yourself first?
Yeah, thank you. Hi, my name is Emily Rain. I am one of the GC Connections interns. I recently graduated back in May from Purdue University with my bachelor's degree in genetics, and I also had a minor in psychology. I worked in undergraduate research throughout my college career, and I also have recently worked as a virtual scribe for a mental health center. And Anna had said, I am going to be an applicant for genetic counseling programs.
Thank you, Emily. So, my name is Tina. I'm working alongside Emily this summer as a GCC intern. I graduated from University of Toronto in 2021. I did my major in biotechnology with a minor in psychology as well. Right now, I'm working as a genetic counseling assistant at a fertility clinic in Toronto, Canada. And very hopefully, we'll also be aspiring genetic counselor as well in the upcoming future. So before we begin with our presentation, we would just like to let you know that we will have our Q&A session towards the end. So if you have any questions for us during the presentation, feel free to drop them in the chat for us.
First, to start off with, for anybody who is unfamiliar, just wanted to give a brief overview of genetic counseling. So, this is a field of healthcare that provides information and support about genetic conditions. Individuals who seek genetic counseling services may or may not have a predisposition to a genetic condition based on personal or family medical history. It is the responsibility of a genetic counselor to educate patients and their families about the process of genetic testing and to also interpret those results with patients who choose to participate. Genetic counselors also work in a variety of specialties, including pediatric, prenatal, and rare disease. So there are definitely a wide variety of benefits of genetic counseling, specifically in a rare disease setting. They can provide a level of expertise in a specific rare condition that other healthcare providers don't have. They can just really help you find resources and supportive communities such as OAA, and just overall unique and specific insights to help you in your journey with a rare disease.
So let's talk about our goals going into the summer internship and some of the main projects that we focused on. The first one is to design new surveys for us to transition onto the new Nord registry. And second of all, we would like to have as many chances as possible to interview all the patients and caregivers from the community so we can know more about them. Last but not least, we would also like to enhance community engagement via social media by creating different posts and being creative. So, going into the internship, our understanding of OAA's mission is to empower families with knowledge and resources for OA metabolic disorders. And our learning objectives is to first understand what's the information and the resources available at the moment, and to grasp the importance of the Nord registry, and to connect with patients and caregiver community by having the interviews with them, and also, most importantly, to gain insights about efficacy in rare diseases environments.
So, as Tina had just introduced, an aspect of our internship over the past 6 weeks was to design surveys to collect data from caregivers and patients with organic acidemia for the new NORD patient registry. We had a couple of goals in mind as we kind of created these. First, being we wanted them to be relatively quick and easy for individuals to fill out. We understand that caregivers have a lot of responsibilities and not a lot of time. So we wanted the process to be as simple as possible because filling out these surveys and collecting this data is so extremely important. This information can go towards research that addresses different aspects of the condition and disparities in treatments to hopefully overall improve the quality of life of patients with organic acidemia. OAA also uses this information to gain a better understanding of the challenges that caregivers face so that they can learn how to better support them in specific areas of their life. We had two separate surveys that we created to kind of gather this information. First being was the caregiver survey, and the goal of this one was to gather information from caregivers about their experience as a caregiver. We asked questions to learn more about different aspects of their life, including emotional and physical health, their support systems, treatment logistics, and their diagnostic experience. We also created a genetic survey. As we kind of know, in rare disease, there is definitely a limited amount of information available. So, the priority goal of this survey was to gather condition type and mutation data to, again, hopefully enhance research and to improve treatment options. We also ask questions to learn more about the diagnostic experience, any history with genetic testing or genetic counseling, symptoms, and any history of the patient being involved in clinical research.
So, just to share a little bit about the data from the current registry, which has been happening from since 2017. And we just want to provide some more data about registration and completion. We understand that 139 individuals have registered for the registry and have consented into this as well. However, it's only about half of them who have completed the surveys. So we're really encouraging participants to complete their surveys as much as possible so we can collect more data. A second pattern that we observed from analyzing the data from the current registry is that we observe a gap between the age of the first symptoms appearance versus the age of the diagnosis. So, as we understand, in rare diseases environments, it's really hard to diagnose a certain disease if it's not very commonly known or acknowledged by the healthcare providers. That's why we need more data collected from the registry so we can have more clinical research and articles to be released to increase exposure of this rare disease to healthcare providers so that they can better identify symptoms and makes the diagnosis more efficient. That's why hopefully once the surveys gets approved by IRB, we really encourage all of you in the OAA community to help complete the survey. So for the next section, we're going to focus on the interviews that we've given to the patients and the caregivers. The goal of this is to gain insights from their diagnostic journeys and to understand any challenges or obstacles that they face during and how they want the community to provide more resources on. So, for example, we can learn more about what support that they think we can work on and some of the resources that we can further provide as well. So there's actually a lot of common themes that we that arose from the conversations that we've had with the patient and the caregivers. One of the things that really impressed me is the theme of the power of listening. So we understand in rare diseases, it's difficult to come across a healthcare provider that is super knowledgeable about the condition. That's why some of the caregivers actually told us that the doctors are not familiar with the rare disease, and in return, the caregivers and the patients actually have to teach the medical team on how to navigate through the condition and the treatment options as well. So that's really interesting to hear. And this exactly really shows how important it is to actually hear from the patients and the caregivers directly when caring for them, so we can actually know better about their specific medical needs. And this is such an important lesson as we are going into the field of genetic counseling, so we can listen better and have the power of um, narrative medicine, essentially. Um, a second theme that we found really interesting is about family dynamics. So, understanding that there could be struggles in siblings with or without condition, we did interview two families. For the first one, they've had the first child affected with OA. And when they're planning for the second pregnancy, they actually were thinking it would be best for the whole family for the second child to have the condition, so that it's easier and it's easier in their upbringing styles. And for the second family that we interviewed, the mother was hoping that the second child would not have the condition. So the differences in how they approach family planning is really interesting to see, and it's really inspiring for us to learn more about their perspectives when caring for a bigger family. And other than that, we're really intrigued to see the differences in coping mechanism in the face of diagnosis. As we understand, within rare diseases, at the beginning is always the hardest because you feel like there's not enough information to know more about the condition. Sometimes there's not a lot of resources to find help from. And sometimes people will also say, I haven't even heard of this disease beforehand. So it's important for us to know about the family support systems, and such as family and friends. And one even mentioned that their neighbors are of great help and have really good knowledge about the condition. And last but not least, of course, the OAA community and how they can support the families better.
Yeah, so one of the other themes that we had found throughout our informational interviews was the topic of mental health. I think through a lot of our conversations, we learned a lot about the mental toll that a rare condition can have on a patient and their family or caregivers. This looked like potentially the fear about the unknown of the future. Maybe a patient was having some anxiety about constant doctor visits or hospitalizations. And one of the most important things that we found was kind of the feelings of isolation, as Tina kind of mentioned. I think a lot of times it can be very frustrating to be surrounded by healthcare providers who don't understand the complexities of the condition, or not having found other families who have gone through a similar situation as you. So I think that really kind of inspired the importance of not only caring for a patient's physical health, but also caring for their and their family's mental health. Finding like a support system or a community that you can go to for help or questions in difficult moments, or maybe seeking professional mental health services to help you better cope with different hardships or challenges can really make a huge difference. And at the end of the day, really learning to understand that it's okay to ask for help. One of the other things that we found that was pretty interesting was that we found that it oftentimes a patient will have a family member, maybe even their caregiver, who has a background in healthcare, maybe as like a nurse or a social worker, and that this will actually oftentimes have an impact on their experience with a rare disease. Maybe it kind of helped them better know how to advocate for their child or for themselves. One of the patients that we had the opportunity to talk with had mentioned that her mom was a pharmacist, and kind of seeing how her mom had advocated for her patients had actually inspired her and helped her learn how to better advocate for herself in healthcare um, settings. Um, Another example may be that having some sort of specific background in insurance could help you better navigate like coverage for health reasons. Um, on the flip side, kind of maybe this background information or knowledge and seeing certain things in your career could affect things differently, like potentially your confidence or positive outlook in caring for a patient with a rare condition.
Yeah, I totally agree. I feel like some of the things that I really remember a lot from the conversation are really impactful and to kind of shape who we want to be as a future genetic counselor as well. I remember an interviewee saying that she felt really isolated at the start when she found out there's something wrong with her child, and she doesn't know anyone else with the same condition, basically. So, or anyone in the area with a similar condition, even. So, she felt kind of really powerless and kind of not sure where to go forward with. And but later on, she got connected to a family through OAA with the same condition. They might not live very close together. However, they still have this virtual connection of um, understanding that someone else has made it further than they did. So seeing that really gave them the confidence and reassurance to go forward, and understanding that their treatments or what they're doing is already on the right track really helps them to settle down and make them more calm in a sense that they were hopeful about the future. And in return, the same interviewee actually started becoming more active in empowering other families who, like hers, have just started the journey. So I think the really good takeaway from here is how we can empower people by connection, and we can also do that in return by giving it back to the community as well.
Yeah, I definitely found that to be very inspiring to me as well. I think one of the things that I will take with me beyond everything else that I've learned, but one of the things that really stood out to me from our conversations was while we were definitely asking a lot of difficult questions about challenges or hardships that they had faced throughout their experience, I think what was really important for me to hear was that they were still kind of able to share with us about positive moments or moments of strength for them and their family. Maybe it was like seeing their child laugh or smile or reach certain milestones. I think that from what we've learned, it can definitely be very easy to become consumed by this rare condition and everything that entails um, with caregiving and all of that. But just really being able to notice that your child is growing up and learning and has special things about them that makes them unique, and um, that they are a person outside of their condition as well. And so I think that that was one of the things that I found to be very inspirational. So yeah, so overall, me and Tina are definitely very grateful for this opportunity to have been able to interview the patients and caregivers. I think that we can do all of the information or informational research that we want online in terms of looking at the OAA website and reading about testimonials and the newsletter. But I think that nothing really compared to this opportunity to be able to have conversations with people and build connections and get to know them as a person and really just learn about their emotions and motivations and goals. So I think that this opportunity to get to peek into their life in this sort of way was very impactful for the both of us in our journeys to becoming genetic counselors in the future. So I think that we definitely learned a lot throughout this experience, even though it seemed to go by very quickly. I think I can speak for the both of us that we had never heard of organic academia before we began this program. So we truly just learned a lot about the technicalities and logistics in terms of the different variations of organic academia. I think we both found it very interesting that even amongst a rare disease, some of the subtypes were even more rare than others and had less information available. Um, I think we definitely learned a lot about different dietary changes and restrictions that had to be made, and just truly all of the hard work that goes into caregiving. One of the things that we both found to be very inspiring was all of the changes and contributions that a caregiver had to make in order to care for their child with organic acidemia. We talked to a lot of parents who went really above and beyond in their new role as a caregiver. We talked to a mom who had become a board member in an organization similar to OAA. We had another patient who had decided that she wanted to build her career into the healthcare because of her experience with a rare condition. Um, so I think just learning about how they had truly like changed their lives in a positive way and was really inspiring for both of us. Um, and then again, things that we've touched on this already, but really the power of connection and learning about how families had been able to find each other and pull each other through tough moments. Really gave us a better understanding of the importance of organizations such as this, especially in for a rare condition. Another thing that we definitely learned about through our experience in creating these surveys was the different registries. I personally didn't really understand a lot about the importance of patient-reported data, but in that project, we definitely learned about how important it can be for research purposes and helping families find each other in communities such as this.
Yeah, and because that we have this interest within genetic counseling, it's really interesting for us to see how it really works within the efficacy aspect. We understand how from some of the patients' conversations that they told them that they were really grateful to have met a really knowledgeable genetic counselor at the beginning of their journey who tells them a lot about the useful information and resources available in treating with the OA. So that really gave them a really good boost at the beginning and provided extra reassurance. However, some patients might not be as lucky to have met someone that is really knowledgeable and knows a lot about the condition at the beginning. So that was really tougher for them as well. And from this, we really understand better of the role of a genetic counselor within a patient's journey, of how they're really good at educating patients to provide a better understanding and provide the resources available to them. And it's really important for them to be a good listener as well, as we've mentioned. And we also really need to adapt to new information as well. And no genetic counselor can know everything about every condition for sure. So we have to research on a new condition if needed, and then taking the time and the effort to notice and to care for the minority of the population is really important. And last but not least, I find that genetic counselors within the rare disease field has to be very detail oriented because this is especially helpful in rare diseases because there are so many adaptations to be made within their lifestyles that need to be cautious about. So I feel like at the end of the day, really learns a lot about the role of a genetic counselor in efficacy. So learning more about this, it kind of really reinforced our interest going into genetic counseling. Understanding that there's a lot of slow but progressing changes within the field. I'm really interested in joining some nonprofit organizations for rare diseases when I become an actual genetic counselor on the side.
I think one of the reasons that drew me to genetic counseling in the first place was the educational aspect. But I think through this experience, that really reinforced the power of knowledge that genetic counselors can provide to patients, and how important that can be in their experience and navigating different healthcare situations and communicating with healthcare providers and learning how to better advocate for themselves when they understand what they're advocating or not, or when they understand kind of the more complexities, allows it to be easier to advocate for themselves. I think one of the other things that I found to be very interesting when we started working with OAA was their their drive to fight for newborn screenings. One of the reasons why I have been so passionate about genetic counseling and genetic testing was the early intervention, and I think working with OAA and learning about organic acidemia really reinforced the importance of early intervention and how important it is to make those diagnoses as early as possible, and how much that can affect um, being able to or caring for the individual with the condition. And so that definitely reinforced why I want to be involved in this field. And then just overall, how the conversation that we had really reinforced how impactful that a genetic counselor can be in a patient's journey. And um, that really feels very inspiring, and encourages me that this is something that I really want to pursue.
Yeah, so this journey has been really great, and of course, we couldn't do it without you guys. We really hope that our work here with the surveys and with interviewing patients can really help support OAA's goals pushing forward. And we're really appreciative of the opportunity to work with the OAA team and the community, with the patients and the caregivers. And we're really especially grateful to our GC Connections supervisors, Anna and Jessica, as well, and to all those families who share their stories and all the previous surveys participants. And we're really hoping that once the new surveys become available, then more participants will be able to complete them as well.
Thank you so much, Tina and Emily. So we're going to launch right into questions. I see that Lena, you wrote a question. Does the survey include the written part by the families and interview part? Would you mind elaborating on your question? I just want to make sure
I
that I'm
think
understanding it
I think
correctly.
it's easier just to talk through it. So how were these the surveys where they were sent by? First, how did you identify the families? These are already in the registry, right? And you send them survey by email. Is the survey, does it have a questions they need to answer and send it back to you? And is there then a second part that you need to talk to the family to get more information? I mean, if you can show example of the survey, the questions, the information that you collected, I think that would be helpful. But thank you. I mean, first I want to say thank you. It's a great presentation. But I would love to know like what kind of survey, more like if we can see questions and elaborate more on that.
I'm happy to field this question unless Tina or Emily, one of you want to field it, and maybe one of you wants to pull up the survey. Tina, do you by any chance have it nearby?
Yeah, sure. Give me a second.
I
Um,
just wanted to share that they asked me to ask parents to participate for this particular project, to be a part of the group of parents, not necessarily being in the registry, but I sent out a request asking if they would be willing to speak with these genetic counseling students for this particular project. So that's kind of how we found the families through OAA.
Mhm.
Yeah, so there were two main components to the internship. One component was creating a deliverable for OAA, and that was the caregiver survey and the genetic survey. And both of those surveys have not yet gone out to the OAA population because they have to be IRB approved, which is like a little bit bittersweet for us because we're not really going to see the fruits of our labor. We're not going to see the survey responses. Um,
Mhm.
though I am really curious what kind of response there will be. But the second part of the internship was every week, Emily and Tina did interview a caregiver or a patient that is part of the OAA community. And so, like Kathleen explained, there are two separate entities, the surveys and the interviews, though, I mean, everything is within the OAO community, so they're linked in that capacity. But here is a survey that Tina pulled up. Tina or Emily, do you want to just briefly explain um, what went into the caregiver survey?
Sure. I can start with the caregiver survey, and perhaps Emily can explain a little bit about the genetics one. So for caregiver survey, we really based off from the experience that they have as a caregiver, and we want to know where the burden or like stress or like strength, moments of strength might be coming from, and from the conversations within the interviews, it really helped us to kind of elaborate more. And for example, we start with more factual information asking about how long they have been a caregiver and how many people that they're caring for. We also have questions such as how many hours that you spend on a daily basis on caregiving, how the diagnosis was made. And we also have questions asking about if they have any support for mental health. And other things that would be interesting for us to know more is what type of resources.
I can't hear you.
Tina, for some reason, we can't hear you anymore.
No, I still can't hear you. I can keep going if you have an issue.
Perfect, Emily. Thank you, Emily.
Um, yeah, but I think just kind of the remainder questions were asking again about like resources that they have used to support them um, in terms of like um, and then what was like most impactful support system again. And then I think we asked a couple questions about kind of their experience with OAA or things that they would be looking for that could better support them towards the end of the caregiver survey. But I think you kind of asked like kind of the format, but like I said, like when I during the presentation, but we really wanted this to be like as easy as possible for people to fill out. So all of our questions are like check boxes or fill in the blank, like really quick fill in the blank or multiple choice, something like that. Um, but we still wanted to be as elaborative as possible and trying to get the most amount of information. So hopefully we were able to obtain that goal. Um, but
And
yeah, and then
this will be incorporated in the OAA Natural History Registry once we get IRB approval and we move to NORD's 2.0 platform.
Okay, great.
And we still need to have Dr. Kim Chapman is our PI,
Uh-huh.
and she will be reviewing these as well. So it won't be available for our families, the ones that will be completing this until we transfer to the new Nord platform, sometime hopefully in the fall.
Mm-hmm. Yeah, thank you. Yeah, this is great. I think one of the valuable things. Like everyone focuses on the patients, but I mean, it's nice that you have a part that's focusing on the families and the support system that they have, because that's the other part that sometimes we as physicians fail, or get short, and the genetic counselors always come in there to fill that gap.
Right.
So.
And I do want to also acknowledge Haley Stubbs, who's on the call too. She has also been a volunteer intern. I guess you can use that name, but she came to us from Nord, helping with some of the transition pieces of moving to the Nord platform prior to the two interns, Emily and Tina, coming on board. So there was a lot of transition, a lot of things with the consents and protocols and those types of things that we have to move from the current platform to the new platform. And she was has been very helpful. And she's also been real instrumental working with these two interns too. So I want to thank Haley publicly for helping out as well.
Thank you, Kathy. I wanted to also say,
do you have
Emily
anything
and
to
Tina
contribute
did.
to work? I know you helped with the caregiver survey and some of these surveys too.
I gave a little bit of feedback, but it was honestly all Emily and Tina. They did an awesome job. And I think they really captured questions that would create like a holistic picture of what it's like to be a caregiver. And they did an awesome job with that survey and the genetic survey. And hopefully, once we get feedback on the survey questions, hopefully it'll be IRB approved quickly and integrated into the new patient registry pretty quickly. But we can send you guys updates so you can still see the fruit of your labor.
Yes.
Thank you.
Are there any other questions, burning questions?
We had a couple of our board members on the call, as well as my husband. So if anybody else have any comments or questions, I just think this was a great learning experience, for Tina and Emily. So I'm happy we were able to give them this opportunity. And my only question is how many parents did they get to interview? Was it all four that we suggested that volunteered?
So I think we interviewed five. Am I correct,
Five.
Tina and Emily? Five. So the rotation or the internship was 6 weeks, and this was our time slot, like this meeting right now, this presentation. So we met for 5 weeks. We met different individuals. Every single family was completely different. Different conditions, different challenges, different wins. Um, and we did meet with one patient. So it was just very helpful and inspirational and wonderful to have that type of contact. And Kathy and Haley, I can't thank you enough for really facilitating this opportunity for Emily and Tina. And if there are no other questions, then I hope everyone has an amazing early weekend. Um, and yeah, please stay in touch and let us know when the results come back. Definitely.
Thank you very much.
Thanks for all your hard work.
All
Appreciate it.
right. Have a great rest of your day, everyone.
Thank you.
Bye.
Bye.